Making, I'm going to demonstrate to you the proper way of how to perform tracheal suctioning. So you want to do first is you want to look at the patient's chart to check for any trending vitals and you want to make sure that the patient meets the indications in regards to performing this suctioning. So some indications would be is if the patient you want to keep a patent airway, open airway for the patient. If there's any pulmonary secretions that you need to remove on the patient. Also, in case there's an order to collect this specimen sample of secretion or sputum, then you would perform suctioning in order to obtain that sample for the physician. There's no actual contraindications in regards to suctioning. However, something that you do want to keep in mind is if the patient has high intracranial pressure, you want to keep that in mind because suctioning does apply some pressure to the patient. You also want to keep in mind for the patients who are hemodynamic patients, which is an increase of blood pressure or increased heart rate, because suctioning could elevate those symptoms as well. And then you want to go ahead and gather your equipment, your material before going into the room. So you want to go ahead and grab your gloves. You want to make sure that you have a pulse oximeter, your stethoscope, your hand sanitizer, and of course your catheter. And way to determine the proper catheter size to obtain is you're going to either look at the patient's chart and see what size trach they are, or when you go into the room you can look to see what size trach they are. And we'll just say that the patient in this case is a size 7 of trach. So what you would do is you would multiply that by 2, which gives us 14, and then you would go the next size down, which will give us 12, and that's the size 12 French that you'll get for your catheter size. Okay, so I'm going to go ahead and clean my hands with 3 ml of hand sanitizer and then clean until 15 to 20 seconds or until it's dry. I'm going to go ahead and knock knock. Hi, my name is Mickey. I'm a respiratory care student. It looks like I need to remove some secretions that you may have. So if the patient is speaking patient, even though they have a trach, some of them could still speak. You could ask them to state their name and their date of birth. You want to make sure that you identify the correct patient, or you could just go ahead and look at their wristband. Okay, perfect. So before I proceed, what I want to do is I want to look and make sure that the linings, the proper lines are intact where they need to be for the patient. I want to make sure that there is an ambu bag in the room. Not only that there's one present, but that it properly works. So I'm going to go ahead and obtain it. And what you want to do is you want to go ahead and squeeze it. You want to make sure that the duct valves open and close. So I'm going to squeeze, occlude the opening, make sure it re-inflates. I'm going to continue to occlude the opening. I'm going to try to deflate it, and just as long as it does not deflate, then we have a proper functioning bag. If it's not functioning well, then you go and get a functioning one. You also want to make sure, that you have a mask. And so the reason you want to make sure that you have these, what's very important, is because just in case the patient in an emergency situation, just say that the patient's trach is not in place and you need to bag the patient, then what you would do is you would go ahead and put the mask onto the bag, and then you would go ahead and, just kidding, put the bag on the mask, and then you just put the mask, and you would occlude the stoma. You would occlude it, and then you would have help to help you bag the patient. If you just needed to, if the trach was in place and you just needed to put this over the trach, then the proper way to do it is you just place this over the trach. Okay, and now when in regards to a catheter, in case there is a difference, if it's an endotracheal catheter, that would be a longer catheter because you're going through the upper airway. But in this case, the upper airway is shorter, so the catheter is going to be smaller on this one. Okay, So I'm going to go ahead and, if it's okay with you, I'm just going to make some adjustments to the bed because you want to keep your own safety into mind as well. So you want to go ahead and let them know that you're going to make some adjustments to the bed. So I'm going to go ahead and put the bed rail down. Okay. And then you just want to elevate the bed a little bit. Let them know that you're going to elevate it a little bit. Also, you want to go ahead and look to see make sure that you see what flow meter the patient is on. Or what flow rate the patient is oxygen they're on. So in this case, the patient is on 5 liters of oxygen, we'll just say, because you want to go ahead and make sure you place them back on that proper that proper liter on the when you're done suctioning the patient. Okay, so I'm going to go ahead and listen to your collect your vitals. I'm going to place the pulse oximeter on the patient's finger. I'm going to check their pulse, look at their respiratory rate, look at their overall appearance on the patient, and then I'm going to go ahead and also listen to their breath sounds. Another indication in regards to why the patient may need some suctioning is in case you hear some crackles or bronchi upon auscultation. That would be another indication that the patient needs suctioning. So just going to go ahead, and if it's okay with you, you want to ask the patient if you could go ahead and unsnap their gown just so you could go ahead and listen on their skin to their lung sounds. So they said yes. So I'm going to go ahead and unsnap. And then warm up the stethoscope so it's not too cold since it's going to be right on their skin. Excuse me here. I'm just going to go ahead and sneak in, and in a symmetrical way I'm going to listen to the breathstone starting at the base of the lungs. And then work my way across, take a deep breath in, and then again in a symmetrical way. And then listen here, right there. And then you can go ahead and listen to their neck. Perfect. If the patient is able to move and it is able to, like roll over a little bit, you could listen to the back of their lungs as well. Okay, perfect. Thank you. Okay, so what I'm going to do is I'm just going to go ahead and remove these gloves because this is a sterile technique. I'm going to remove these gloves. I'm going to go ahead and open the package. I'm going to place this close to me. I'm just going to go ahead and open this. Remove this. Dispose of that. Now, prior to doing this, what you want to do is you want to go ahead and place the patient on 100% oxygen. You want to oxygenate the patient first, and also you want to let them know some hazards that could happen. So in this case, upon suctioning, it could decrease their oxygen level. So that's why you want to put them on 100% oxygen. So your oxygen level could drop. You could feel some bronchospasms, and it's more than likely going to cause the patient to cough. So you want to make sure you let them know that. Okay. So we pre-oxygenated the patient on 100%. I'm going to go ahead and open the package. This is not in the non-sterile area. So there's a little box here, which is used to put some saline water in here, just in case you need it. And I'm just going to go ahead and open this. And I'm going to go ahead and grab my glove. Okay. So since this is sterile, I'm going to go ahead and remove this. My catheter is in there. I'm going to go ahead and grab my other glove, move away. Again, keeping in your sterile. So now it's sterile to sterile. So my hands are still sterile, like I said. I'm going to go ahead and grab my catheter. When removing it, you just want to make sure that the end of it, the one that you're going to use to suction, does not touch, your skin, or does not touch anything else, which that's the end of it. Okay, so my hands are still sterile. And so you're going to have one hand that's sterile and one hand that's dirty. Prior to performing suctioning, if the patient needs some oral suctioning, so this is my dirty hand, you could go ahead and use the yogurt to remove any oral secretions from the patient. You also want to make sure that the pressure is correct, and a way to check the pressure is you could just go ahead and remove the yogurt and hold the opening down just to hold and make sure that it meets the proper range. So the ranges for the pressures is on an adult, it's going to be 120 to 150. On a child, it's going to be 100 to 120. And on an infant, it's going to be 80 to 100. So you want to make sure that you have the proper pressure on the patient. Okay, so again, this is my dirty hand. I'm checking the pressure. Okay, so now what I'm going to do is I'm going to go ahead and again pre-oxygenate the patient, remove any oral secretions that the patient may have. And I'm going to go ahead and place this on here. Okay. Again, keeping in mind that this does not touch your skin. Now, when you perform the suctioning, what you want to do is you're going to go ahead and insert the catheter just until you feel some resistance. Once you feel the resistance, that's an indication that you reach the spot, the area, or the patient is actually going to most likely cough as well. So once you reach that resistance, well, when you're inserting the catheter, you don't want to occlude the pressure valve here. You want to keep it open. Once you reach that resistance, you're going to pull the catheter up a little bit and then intermittently put pressure on the opening here, and then in a circular motion pull the catheter out and make sure that you follow the catheter out, because when you take it out, you want to make sure that it's not too loose where the secretions go all over the place. Okay, so excuse me here, I'm just going to go ahead and place this in here. So you're probably gonna feel it's probably going to make you cough. Okay, so you want to do this within 15 seconds. You just want to insert just until you feel your resistance. So you feel your resistance, so you're going to pull back a little bit intermittently, again within 15 seconds, and in a circular motion, and you follow that catheter. Okay, all the way, perfect, there you go. Now, in case they need more suctioning, the patients are pretty verbal and or good at letting you know that they need more suctioning, or you could always just ask them. Okay, and then you want to make sure that you place them on 100% oxygen after you're done suctioning, again to avoid any decrease in saturations. If you do need to oxygenate them again, you could just put this in the saline water, in the sterile water, and then go ahead and clean that out. Now, when obtaining your secretions, you want to go ahead and pay attention to the color of the secretions, the consistency, the amount, and the odor, because that's going to be something that you want to document at the end. So we went ahead and oxygenated the patient back on 100%. I'm going to go ahead and dispose of this. We remove that. Okay. Going to put the yogurt back on in case they need some more oral suctioning. You can go ahead and perform that. Going to go ahead and remove my gloves. Going to go ahead and get a new pair of gloves, and that way I could I'm going to get a new pair of gloves just because I'm going to reassess the patient. Okay, so I'm going to go ahead and check their pulse, check their oxygen, check their blood pressure, re-listen to the breath sounds, and then going to go ahead and make sure that in case they need make sure that the patient is doing okay. I'm going to put the bed back to the way it was, and then by this time I already removed the patient off of their 100%, and I'm going to put them back on their 5 liters that they were on originally. I'm going to put the handrail back up. Make sure that the patient's call light is close to them. In case they feel as though they need more secretions, then they could go ahead and just give us a call. And then I want to go ahead and I'm going to go ahead and then I'm going to remove my gloves, and then I'm going to grab my 3 mLs of hand sanitizer. Thank you. Say thank you to the patient. And I'm going to step outside and I'm going to document. And what I'm going to document again is going to be the color, the odor, the consistency, and the amount of the secretions, if the patient tolerated it well, and that I put them back on their proper liter flow. Okay, so I'm going to, of course, dispose of my garbage here also before leaving the room. Okay, so that's the way to properly perform tracheal suction. Thanks for watching.